Dr. Paul Scherer to speak about his new book, Recent Advances in Orthotic Therapy. So, Paul, what can you tell me about this new book?
Josh, after all these years of orthotic therapy, especially within our profession, we've been making orthotics for 50 years now, and no one has provided a text so people could learn a little bit more about orthotics. I thought it was about time we had our own book about orthotic therapy.
But really, Paul, who's going to read a book about orthotic therapy?
Josh, this book is for anybody who makes orthotics. We haven't had a book like this. It's a how-to-do book, but more than how to use the orthotics for successful patient treatment, it's more important than that, because what it did was it gathered all the evidence about the different pathologies and its relationship to orthotic therapy. So someone can pick up the book, look up a particular pathology like plantar fasciitis or functional hallux limitus, read what's in the medical literature about it, and read what kind of orthotic prescription would best treat that particular deformity.
Paul, the title says a pathology-specific approach. What does that mean?
Just like treating anybody with any modality in medicine, it's important that you use the right treatment for the right pathology. In other words, one orthotic doesn't fit everybody, nor does it fit every pathology. The idea is to pick that specific orthotic to meet the needs of that particular specific pathology.
Well, explain to me how this book is constructed.
I designed the book in a way so that it's easily usable in the practice. The beginning of the book describes pathology-specific concepts, and then after that we pick 8 different pathologies. And each pathology, we get the history of the pathology, what's been done before, what evidence is in the literature, and at the end of each chapter, there are recommendations for a particular orthotic material, orthotic prescription for that particular pathology.
Paul, what sort of help did you get from your contributors?
I got a tremendous amount of help from my contributors, most importantly Kevin Kirby, who wrote the introduction and gives a history of orthotics in the medical literature and where it came from and where it's going. The other contributors of the book all have worked with me over the years in producing a great deal of information for the profession, describing the different pathologies and how orthotics are made for those particular pathologies.
Paul, any last things that you would like to say about how you hope that this book will help podiatrists?
I hope this is the first in a series of editions of this book. I think we can add to this book as time goes on if it's accepted well. I think it's designed to be a reference guide for the student, for the clinician, for the resident, and I hope it's used in that way as a reference guide.
Well, Paul, congratulations on a job very well done, and I wish you tremendous success with this. I think it will be a great contribution to the profession.
Thank you, Josh.